we're going to use a therapy ball or a stability ball. You don't necessarily need to have this, however, it is something that we find beneficial to use during pregnancy, so it might be worth investing in. Now, the key to core stability exercises are activating a particular muscle in the abdomen called your transverse abdominis. So if you think about the outer layer of your abdominal wall being those six-pack abs, the rectus abdominis, peel that away, then you have 2 layers of oblique muscles that you will activate with rotational activities. The transverse abdominis actually sits deeper than that. When you activate it, it creates almost like a corset around your spine. So it's super important when doing core stability exercises. Now, one thing you do want to avoid if you have noticed that you are starting to have some separation of the abdominal wall during pregnancy are sit-ups. That can further cause, some more stretching of the abdominal wall. So we want to avoid sit-ups as much as we can. So these are very low intensity exercises that again will activate that transverse abdominis muscle. You're going to sit comfortably on the stability ball. Now what we're going to do is perform what's called a pelvic tilt, or kind of create like a neutral spine position. So I'll show you from the side here. Naturally we have a little bit of an arch in our low back. So what we're going to do is tuck the tailbone down, draw the belly button in, creating a neutral spine. Now in doing so, you also want to perform almost like a Kegel, where you're sort of trying to stop the urine flow, and that can help kind of do 2 things at once here. So again, we're starting in our normal lordosis in the low back. We're sort of reducing that, kind of creating a neutral spine, and then just holding for about 5-10 seconds. Making sure we're breathing. We're drawing the abdominal wall in. Now, when you're doing these bracing activities, you don't want to hold your breath like you're creating what's called the Valsalva maneuver. We don't want to do that. We want to make sure we're breathing into the exercise. So it should be a very subtle contraction, again drawing the belly button in towards your spine. You'll notice the belly kind of shrinks in a little bit. Now, ways to progress with this one. We're going to sort of hold this pelvic tilt position as we begin to gently just raise one foot off the ground and march. I don't really like to count with this one, so it's really just doing as many as you feel comfortable doing. You can also hold a chair if you need to. This does get harder as you are further into pregnancy, so you can definitely hold on to something if need be. Make sure you're breathing properly. It doesn't really help to talk during it, but. And then we can also kind of relax that tilt, find the neutral spine again, and then just do some small circles clockwise and counterclockwise, maintaining that contraction the whole time. So this is kind of step 1 with finding how to engage those deep abdominal muscles. Sometimes it is hard to learn how to do this activity. The less frequently those muscles are engaged, the harder it is to sort of reactivate them. So it does take some time, but the more you practice, you'll start to develop some muscle memory and it will get easier.